This is Drew Warner, medical record number 589-135-1326. Date of birth is 03/11/1967. This patient has pneumonia. He has a history of hypertension. Has a PEG tube for nutrition. Okay, he has no known allergies. And so I'm looking here for his 10 o'clock medications. He's going to get erythromycin 250 milligrams per G-tube, potassium 20 milliequivalents, and also Lopressor 50 milligrams for that. Okay, he also has acetaminophen 640 milligrams elixir every 4 to 6 hours, but he says he's okay. I went to check on him. So as far as his medications, like I said, he has no known allergies. So he's been on this erythromycin 250 milligrams. I would want to make sure that I check him for any type of an allergic reaction. Potassium that he has 20 milliequivalents. I want to make sure that I check his electrolytes to make sure that's within normal limits. He's also on Lopressor 50 milligrams, so that's for his blood pressure. I need to make sure I do an assessment, take his blood pressure before I actually give the med. Okay, I'm going to check really quick to get his check medical record against the doctor's order. So you have potassium 20 milliequivalents, erythromycin 250 milligrams, 250, and I have Lopressor 50 milligrams. These are all for 10 o'clock. Okay, so I'm going to put my doctor's order away. Take my medication record out. For Drew Warner. Here's Drew Warner. Pull his medications out. I'm ready to do my first check. I do also need some medication cups. Okay, so I'm going to look for potassium. He's got an elixir here. So potassium 20 milliequivalents, and he needs 20 milliequivalents, and 20 milliequivalents here is equal to 30 mL, so I'm going to give him 30 mL of that. And then erythromycin 250 milligrams per 5 mL. His dose is 250 milligrams, so I'm going to give him 5 mL of that. He's also on some Lopressor. Lopressor, it's 50 milligrams per G-tube, expires 2020. So that was my first check. Now I'm going to go ahead and do my second check. Erythromycin 250 milligrams, expiration 5/15/18. Potassium 20 milliequivalents. Expiration date is 3/20/19. And my Lopressor 50 milligrams per G-tube. Because these are elixirs, what I'm going to do is I'm going to label it. So I would just write on here potassium, erythromycin, and this one is the Lopressor. Let's do the potassium first. 20 milliequivalents. I need 30 mL. And say, for example, you got from the pharmacy was a tablet. Instead of crushing it, you can ask for a different form and say, okay, he's got a G-tube. I need the elixir form. My erythromycin. 5 mL of this. my third check. Pressor, 50 milligrams, 2020, and I'm going to crush that. And this is my potassium, it's 3 mLs. My erythromycin, 5 mLs. Okay. So I have to crush this. What I'm going to do is I'm going to save this label because I'll scan it in the patient's room. Just did, I touched the tip of this. Like if you had many drugs to mix up, you know, try to think about, you don't want to mix this up and clean it and then do the next one, you know what I mean? If any way you could hopefully get things in elixir form, it's a lot easier. Okay. Okay, so I'm done. I did my third check and I can put my stuff away. Mr. Warner, how are you? I'm Janice. I'm your nurse today. I have your medications for you. How are you feeling, sir? Okay, your medications I'm going to give through your tube. Just wanted to ask how you're feeling. Are you feeling bloated at all, or are you feeling any indigestion? Okay. I have some medications. The medications I have for you, one is Lopressor for your blood pressure. One is your antibiotic. And again, with the antibiotic, have you been feeling any kind of, you know, side effects as far as maybe nausea or any of that? Okay, good, you're feeling all right. Okay, let me just go ahead and wash my hands really quick. And Mr. Warner, could you please state your first and last name, please, and your date of birth? And do you have any allergies, sir? Great. Okay, let me go ahead and take your set of vital signs. That's good. That was, you know, blood pressure is 120 over 80. Okay, and I'll also take your heart rate. Just go here and do this. Okay, 88. Great. Okay, Mr. Warner, I'm going to sit you up. You need to get up really, really high. And that's only because as I give you your medication, it'll help to medication by gravity, hopefully go down if it's digested well. And I want to take a look at your G-tube really quick. And I want to make sure I put my gloves on. Now we'll check around the site, make sure that's okay. I'm going to put a little drape around you, sir. It's just to help protect if it leaks at all underneath. Okay, very good. I've turned off your continuous NG feeding. First thing I want to do is I'm going to check for placement, and I'm going to just inject a little bit of air right. No residual. Just checking to make sure everything is working okay, sir. Just gonna grab some water and irrigate a little bit. Looks good. At this point now, if I want, I can go ahead and check scan my meds. And with this, obviously, I don't have the bottles with me, but I'll have to either there is a way to go ahead and chart it as well manually, but I would make sure, I would document to make sure what these were. Okay, sir, I'm gonna go ahead and give you your medications now. Your blood pressure was okay, so the first medication I'm giving is your blood pressure medication. Do a little flush in between. Give your potassium. Should be about 30 cc's. And think about it, if your patients are on fluid restrictions, how much total you're giving them. The flushes all count, all of that counts. So you want to make sure. Okay, it's all in. Okay, how are you feeling, sir? Doing okay? All right. So I'm going to clean up my mess. Looks good around the area. Make sure I put this away. All my equipment. And then for him, I probably wouldn't put him fully all the way down. I'd put him like in a 45-degree angle. Then depending upon the medication, you might want to turn the wait a little bit before the medication's all in, before resuming the feedings, and you can flip the feedings back on afterwards. And I would always time it, because sometimes when you're giving continuous feedings, you want it every 8 hours. If you started it and interrupted with a lot of different medications, it's going to throw all of your feedings off, because that feeding is good for so much. So like when you have in your chapters for fundamentals, nutritional therapy, look and see how long, I don't know if it has there, but sometimes on the cans it tells you how good your feedings are for. You need to make sure that you complete it when you're supposed to complete it. Okay, I'm going to take out my gloves, wash my hands, put them down to the safe position, side rails up, and that's it. Okay? All right, so why don't we take a break and then